Cervical Cancer Prevention Foundation has produced this information video regarding the steps how to prevent cervical cancer. Now, there are some basic points we will look at. Cervix is located at the end of vagina or beginning of the uterus. It is also known as mouth of the womb. By doing internal examination, the cervix can be easily seen. Hence, cervical cancer is the cervical only cancer in human body which can be prevented, because cervix can be seen, examined, tested and treated by simple internal examination. Here is some quick facts about burden of cervical cancer in our country. It is the number one cancer in women. More than a quarter, that is 27% of world cases, are in India, which is very high because India has only about 11 to 12% of the world population. That makes it to about 2 lakh cases which are diagnosed every year. More than a lakh of cases of women die of cervical cancer every year. 97% of these can be prevented if we do regular checkups and screening. This means that every 7 minutes there is one death, which is a very disturbing figure. Some important factors about cervical cancer: that precancerous changes occur about 7 to 10 years in advance, so we have enough time. The highest rate of cervical cancer is after in 40s and 50s. So if we say 10 to 15 years before the changes start, the screening should start from the year of 25 or so. Normally, precancerous changes do not have any symptoms, or they might be mild symptoms like white discharge or bleeding after intercourse or untimely unscheduled bleeding other than normal period. Symptoms appear generally at a very late stage, and in clinically what we see that most of the cases are non-operable, that is they are of advanced stage, so they cannot undergo surgery and radiotherapy is the only thing. Hence, considering these facts that it's a significant problem in our country, it's a preventable cancer, the testing is easy, that's why it is recommended that we should undergo the test. Now let's see what are the tests which are done. The commonly known test is called Pap test. Pap is the name of a gynecologist who started this, called Papanicolaou. It's a short form of surname Papanicolaou. He described these tests. So here what we do, we take the sample from the cervix by a brush and collect it and send for examination to the pathological lab. There are two tests which are done. One is called liquid based cytology. That means to see these cells, how they are being observed under the microscope. And second is the presence or absence of the HPV virus or its DNA. If the test report is normal, then this pap smear is repeated after 2 years and no other treatment or no other test is necessary to do. If the pap smear, that is the liquid based cytology or the HPV, is abnormal, then a colposcopy is advised or needs to be done. We will see what colposcopy is in our next slide. Colposcopy is a method wherein a set of binoculars or magnifying glasses are used to see the cervix, so one can get a better and clearer look at the cervix. In pap smear, we take cells from all area of cervix. We don't know from where it is coming. In some cases, they may be coming from the top or 12 o'clock or 6 o'clock or 9 o'clock or 3 o'clock. So colposcopy helps us to see the area of abnormal cells. It's a simple test which is done in a routine clinic. There are no needles or pins or required in this, so there is no pain. It's like any other internal examination. Normally it takes about 15 to 20 minutes and patient can go home in this time. So the principle of doing colposcopy is to identify normal areas or low grade cancerous changes or high grade cancerous changes or even cancer in some cases, that from which area in the cervix it comes, and then depending on the abnormality and the extent of abnormality, this area or precancerous changes are treated so that they are stopped from developing into a full-fledged cancer. There are methods where this abnormal area or precancerous changes are stopped from progressing to cancer. And these methods are called as cryocautery, loop excision, or diathermy. Some of these procedures are done in outpatient or in clinic, uh, but for some procedures, some patients may need to be hospitalized for a day, which is called as a day care hospital admission, wherein patient stays in for about 3 to 4 hours of the time, and under anesthesia, this area is removed so that the cancer does not develop, and then patient is discharged back. Now, if we summarize the steps in which we use to prevent cervical cancer, it starts with the Pap test. If it is normal, one needs to repeat in 2 years, and this keeps going on till the age of 65. If it is abnormal, then that means there are some abnormal cells coming from the cervix. We don't know from which part of the cervix, whether top, front, left, right. Hence, colposcopy is done to see and remove these precancerous areas. And then again, one needs to repeat the smear to make sure that all the precancerous abnormal cell area is removed, the smear is normal, and the patient is returned back to a normal screening by doing every 2 years the Pap test.